questions. At the back is lots of UCL literature, tote bags and syringe pens. Do help yourself. Tea and coffee everyone's found. This is quite difficult because I can't. There we go. So, why study at UCL? So it's the 7th best university in the world. It's got the best academic to student ratio in the UK. It's the best performing university in this EU project. It has 29 Nobel laureates. It's the 4th highest rated university in Europe for employability, 2nd most cited university in Europe. The Institute of Education is the best in the world, and that's practically important because the UCL Institute of Education tells us how we have to do, in all the other departments, instructs us on how we do our education. So I had to go on a not short training program from them, which was good, but it's very much research-led, evidence-based education, and it's coming from the best education in the world. And the central London location, which more of this is in this About UCL book. I'm not going to go through the whole thing again, but do take one there at the back of the room and all of the benefits of our libraries and resources and gyms and things that you might like to do. So for biomedical health research, it's the most cited institution in the UK. So it's very much a research-led rather than an education-led university. Why this is important, it means that research is tied in to all of the postgraduate taught programs. So it's setting everybody up for research and weaving research through all the modules. And the idea is that you two, if you come on the program, will also be one of the most highly cited people in the UK. So just for comparison there, it's UCL number 1, and they're about 3,000 citations behind is Oxford, and then another 2,000 citations behind that is Cambridge. So we really are way ahead with our research output, but not just research output, quality research output that people are citing in research all over the world. So why study pain management? Most people are studying it for career progression, which is great. Does anybody know the Latin phrase at the top where that comes from? Where I got that one?
It's on the Pine, Faculty of Pines thing.
Yeah, the Royal College of Anaesthetists and the Faculty of Medicine ribbon banner on their coat of arms. So it means it is divine to alleviate pain. And it is, it's important and rewarding work. Low back pain is the #1 cause of disability worldwide, so you'll never be short of patients. Pain is often undertreated and sometimes stigmatised, so there's definitely an educational need, but also a need for expert level practitioners to go and provide further education in the clinical environment. The National Pain Audit identified a dire need for versatile skill mix expert teams across all healthcare domains, so primary care, the larger community base that is primary care and other domains as well, secondary care, and then tertiary pain services. UCL and UCLH is at the forefront of pain research and clinical pain management, and we've got national and international level expertise. Our international level expertise is abdominal pelvic pain, and our national level expertise, and our international is trigeminal neuralgia as well. And national level, we have a nationally well-known neuromodulation department, and lots of departments really. Most of the things are really well known. There they go. So, if you study this degree, you gain a thorough grounding in the science of pain, anatomy, physiology, and pharmacology. There's no escaping the basic sciences, and we try and get them done very practically, but thoroughly in the first 4 modules, modules 2 to 4 specifically. You'll develop a holistic approach to assessing pain and engaging a person in the management of their pain, and that's much more the second half of the program, modules 5 to 8, and that's a big component of the abdominal pelvic pain section, where it can be difficult to assess abdominal pelvic pain in a sensitive but thorough way. And we also have our module on the strategies for the self-management of pain, which is really about engaging people with pain to take on board some of their own management and give them strategies to do that. The knowledge and skills on this program will enable you to engage with healthcare professionals and research scientists in whichever sphere you choose to work in. We've got a diverse group. So some people are more interested in research or in industry partnerships. Some people would like to work within the large kind of pain pharma or pain devices groups, and this degree would be really great for helping you to interact with them confidently and capably. And similarly with healthcare, whether you're working in the community and wanting to communicate with specialists in secondary or tertiary care, or whether you are working in kind of complex teams that are quite specialist and niche, you can communicate with a range of different professionals across that after this degree. UCL is a leader in biomedical research. It's a world leader. We offer a large variety of expert teaching and a range of outstanding research opportunities. The research opportunities really are excellent. This is a sample of the research that we have going on in the pain department at the moment across various divisions. So we've got work going on toxicity of systemic anti-neuropathic medication used to treat trigeminal neuralgia, Botox for chronic pelvic pain, pharmacogenetics of analgesics, variable delivery rate transdermal, so like smart fentanyl patches, systemic infusion of sodium channel blockers, and kind of looking at pain scales and seeing if we can kind of bring them together and make them better or make them smarter. And that's something Brigitte does a lot of work.
We do a lot of ketamine studies as well.
There is a lot of, Brigitte does a lot of ketamine studies. So within all these kind of research teams, there's huge amounts of actual individual studies that need doing. And so there's lots of PhD level work that needs doing, there's lots of master's level research that could be done. There's really loads, and there's more, this is just a sample. To apply, we'd like you to have an undergraduate degree, 2 or higher in a relevant degree topic. We can put that requirement to one side in that you do need a degree. We would mainly for nurses who qualified pre-Project 2000, and so qualified as a nurse without a degree, or then afterwards did the additional conversion to make a degree but then didn't get a classification. That's the main group of people who we would pop that aside for. You need to be a registered healthcare professional because there may be patient contact as part of the program, we'll come to that in a minute, but also we want you to be working in pain management whilst you're doing the program, because pain management is a practical, interactive specialty. It's not something to be done in the abstract, it really does need to be done with constant interaction with people who are in pain. We would like you to have a clear and demonstrable interest in pain management. This is not a suitable master's degree for somebody who's just done a physiology degree, has not worked, and is ready to just do an extra program. We want people who've been working for a while, who are clear that pain management is them. Because pain management is a difficult topic. It's a difficult academic topic. It's a difficult personal and emotional topic. We need to know that you're committed to the topic. And if you didn't qualify in a university that teaches in English, you need to have IELTS level 6, which is standard. So that's the structure of the program. This is available online, but in a really discreet and hard to find place that nobody finds. But it is there, I promise you. And the website is now in its 3rd iteration in the last month, as they've just merged 3 systems. So it's even more difficult to find. But in year 1, there's 4 modules. And if you're doing the certificate, at the end of those 4 modules, you're done. And then in year 2, there's another 4 modules, and that gets you the diploma. And if you're doing the dissertation, you get the MSc. So we have Introduction to Pain, Economics, Evidence and Delivery. So that module is very much about what is pain, the philosophy of pain, and then the kind of economical background of pain, like the burden of pain across the world. Evidence is very much about research methods and appraising paper. This is not, no offense, Roman, this is not the most scintillating pain module, but it's a lot of stuff that you need to get out of the way in your master's, and we get it straight out of the way. So it's research methods, critical appraisal of research papers, and then delivery looks at setting up and managing a pain service. What are the core components of that? And governance, audit, all those really fascinating things that people like to learn about. Module 2 is acute pain. The division between acute pain and chronic pain is a false one, but we've had to put it in. And the reason we do is because all pain starts as acute pain before it becomes chronic pain. And so in acute pain, we get the initial nociception out of the way. We learn about how pain is conducted, and then strategies for managing acute pain. So from regional anesthesia, regional analgesia, what else in that module? Basic pharmacology of common acute pain things, like paracetamol, NSAIDs, all the pharmacology of that. And then there's a lot of special acute pain situations. So sickling crisis, managing a sickle crisis, non-labour pain in a pregnant woman. Can't remember them now, but there's quite a lot. It's quite an interesting module, it's very practical. Module 3 is chronic pain, so all chronic pain has been acute, and now it comes into this. This is Brigitte, is the lead for this module. This module looks at how acute pain develops chronicity, becomes chronic pain, looks at common chronic pain conditions, kind of the bread and butter of a chronic pain clinic, and then looks at pharmacology and drug management of chronic pain conditions. What you might notice as you go through the course is that opiates come up in every single module with a kind of different slant on them, and it kind of, there's some revision and repetition, but everyone kind of looks at it from a different way, but it's a big topic and there's no escaping it really. Module 4 is pain and cancer patients. So this is mainly looking at this is looking a little bit at people who have cancer and are in pain, but it's mainly looking at cancer survivors who have had chemotherapy and radiotherapy and have neuropathic pain as a result of that, and have chronic pain as a result of their cancer treatments and surgeries. It's a very interesting module. It's very specialist, and it's done by Paul Farquhar-Smith, who couldn't be here today because his kids are swimming in a competition, and he's based at the Marsden, so International Cancer Centre, and it's really a lot of expertise from there. Year 2, so Module 5 sounds like a weird mix of things, but there's 3 big topics that need to kind of go together, but they're not big enough for a module on their own. So headache, complicated topic. Pediatric pain is also needs to be covered. Well, pediatric pain is relevant, but most people don't work in pediatric services, and pediatric pain is a kind of entity in and of itself. And then our international expertise on abdominopelvic pain. So it kind of covers those 3 topics and brings them together into one module. And then module 6 is strategies for the self-management of pain. So this has been done by the physios, psychologists and OTs at this pain management centre, where they take the strategies that they use in their pain management programs and in their clinics and how they bring them to people with pain. Module 7 is neuromodulation. So neuromodulation is using electricity to alter nerve conduction to change the sensation of pain to a less distressing sensation. That's a really broad brush, probably technically academically inaccurate description, but that's broadly what neuromodulation is. It's a lot of spinal cord stimulators, all that. So this is important because neuromodulation is becoming more prevalent, and it's not necessarily to do with how to insert spinal cord stimulators, but it's when you have a patient in your clinic who has a spinal cord stimulator, what do you need to consider, and what are the strategies you can use to help them manage their pain, and what if somebody who's got a spinal cord stimulator develops a new pain in an area that's kind of in the same domain as the stimulator but not quite covered by it. And then the final module is managing pain in the community, which Hanley is the lead for. And this really this module is based on the unavoidable move of pain management from hospital to the community. And this was required from the National Pain Audit. Patients prefer it, the outcomes are very good, but a lot of community practitioners often don't feel that they have the background or knowledge to manage pain as well as they would like. And so this module aims to address that. And it's also a great module to have at the end of the programme, because it brings a lot of elements of other modules together and then adds some new things like engaging the third sector, the charitable sector and kind of other organisations, and also some kind of difficult patient groups or challenging patient groups to manage. So managing chronic pain in people with chronic and enduring mental illness, in adolescents, secure environment, yes,
and addiction.
Yes. So kind of very unusual, but also very everyday at the same time. So they're not situations that we might all be in, but there's a lot of considerations. So that's the programme, and then you'll see the workshop events there running through the year. I'll talk about that in a minute, and then at the end is the dissertation. Again, I'll talk about that in a minute. So the workshops. Why do we have workshops? So there are 3 MSCs in pain management in the country: UCL, Cardiff, and Edinburgh. There used to be 2 others, King's, which moved institution and then didn't have any funding, and Leicester, which used to be the most popular one in the country because it had a blend of online and workshops. And people seem to really value that workshop experience, coming together as a group, bringing different professional backgrounds, different professional experience, bringing difficult cases, talking about them, meeting course faculty, and kind of developing a support network within the pain world. So we've added them for that reason, to try and create that same effect and impact. There are optional workshops you don't have to attend. So there's 3 a year, 1 every term. So we've got international students, so we're not expecting people to fly from Saudi Arabia to do a 1.5-day workshop in London, although they are very welcome if they do choose to attend. So it's not mandatory. If you don't come, you won't be penalised. And similarly, there won't be any new information presented at the workshops that hasn't been presented before, but it will be more group discussion. We'll get, there's experts coming in from kind of related fields. So a good example, I think, is in the workshop that happens around Module 4, pain and cancer patients. We get a lot of the chemotherapy specialist nurses in just to go through some of the chemotherapy agents, give us a bit more background information about the chemotherapy agents and kind of what effects they have. You don't need that information to have an MSc in pain management, but it's helpful information that might support your learning in that module. Will the content be available online if you can't attend? Yes, some of it will. We can record lectures and lecture cast them. That's easily done. We can't, it's not practical or easy or enjoyable for anyone to be like going around with a camera and GoProing everyone's experience to make that available for people who couldn't fly in. So some things will be available online and some things won't. There's 3 workshops here, one in each academic term, and they start at 2 p.m. on the Friday afternoon and go on through until about 5 p.m. on the Saturday, and there's a dinner on the Friday evening. I'll give the key dates for next year's workshops at the end. The assessment, so every module has the same assessments, and it's those 4. So in every module you have to do these 4 exercises. A written assignment of 1,000 to 1,500 words. That's normally something very practical. So in acute pain, I think it's to do an audit report of a small audit of something to do with acute pain in your clinical practice. So are epidural, if you work in an area that uses epidurals post-operatively, are the epidural rates being, is the epidural level being tested enough, for example, and just do smaller. It'll be different for everybody depending on their clinical environment. So that's that. A video presentation lasting 15 to 20 minutes. So we will give you a topic and you will need to record yourself giving a presentation that lasts 15 to 20 minutes with PowerPoint or whatever other visual aids you want to use in the background. This sounds weird, but it's actually a great assessment tool, because if you can't teach it in a presentation, you don't have the knowledge to do it. And it's really good for you when you're preparing it, because it's a quick assessment, you can get it done in 20 minutes, plus the preparation beforehand, and it's good for us to mark because it gives us an idea of where your understanding is. We'll have an online discussion forum, and we just want you to participate in the kind of discussion topics that are set by the module leads at the time, and we'll participate in that discussion with you too. Those online forums, it's participation, it's not MSN chat. It needs to be informed, preferably referenced and opinionated, informed contributions, and then a reflective blog entry. So we need to have, and this is mainly to do with professional codes of conduct. They will all, so most allied health professionals, nurses and doctors will need to have some element of reflective practice. So open up a WordPress, publish 400 words every module, just talking about how this module has impacted on your practice and what you're going to do differently, if anything at all. The assessment is level 7 higher national learning frameworks, so it's testing, it's going to be testing, but it's meant to be practical and meant to be easy to fit in around normal work. A question that I keep getting emailed: there are no exams on this course, there are no exam dates, you do not need to come to UCL to do any exams, there are no exams, just those 4 assessments at the beginning. We do, however, in every module have 20 self-test questions using MCQ, single best answer, extended matching, 10 at the beginning and 10 at the end. Those are formative, we don't collect the results, it's for you to do. The idea is the 10 at the beginning will set the standard for you before, so you know kind of what level you need to be pitching your learning at. Go through, and then at the end it's a new set of 10 at the same standard, and you do them and see, is your knowledge at that level? If you're not scoring consistently 80% or above on your self-test questions, you're not learning the information in depth enough. And some of them are quite tested. Your modulation ones in particular, I think, are quite tricky. We also have lots of reflective questions in each module. We really built in that. So if you can imagine, what's a good example? Brigitte's module uses somebody called Arvinder who has back pain. Mm-hmm. So we give a patient who's got a problem related to what's in the module. So it might be somebody who's having a spinal cord stimulator fitted. It might be somebody who's got pelvic pain. And we would ask you after a section of learning to problem solve something for that person. So we present you with a situational problem and you fill it in. We don't see what you fill in, but we might ask you to print and bring it with you to tutorials. So, hi. And they are really helpful, because if you're not able to answer the situational reflexive question and you're not able to clinically manage and plan for the question that's provided, then you maybe need to go back over that topic again and check. And it's also really good to engage with the module lead and the program lead and the course tutors to say, well, I've been trying to do this situation and I don't feel like I'm getting it right. Could you please help me? And that's a really good prompt for that as well. So, clinical experience, coming to do a clinical placement or attachment here at the Pain Management Centre or UCL, it's not a normal or essential part of the program. You can do the whole MSc program with never setting in foot inside this building again, or similarly over at UCLH main site. However, whether or not you do the MSc program, you can arrange a visit and a kind of clinical attachment experience for yourself. It normally requires a fee to be paid, but course students, if you're on the program, you get priority booking and a more targeted placement experience. By more targeted placement experience, what I mean is if you are planning to become a advanced physiotherapist in the community world, then we might target your experience to be based in some of our pain management programs, to come and sit in more of our physio clinics, and to maybe sit in with the psychologist, and kind of, more target towards them. Those may not be the things you want to do, but it's just an example. And we can organise that much more easily. Depending on what activities you want to have in your clinical placement experience, we can probably reduce the fee of that, or depending on the activities, waive it altogether. It's incredibly easy to have somebody come and sit in clinics and kind of get clinical experience that way. It's difficult to have somebody come into theatre for interventions, injections, stimulator placement, insertion, and all that kind of stuff. We can do it, it's fine, but there's a lot of indemnity issues and we can't mitigate all of that cost ourselves. If you are thinking of doing a clinical placement experience, and I would encourage you to do it, we would suggest doing it in year 2, because then you'll have all your basic pain knowledge and you'll be kind of in the more practical and specialist section of the program, and it'll be probably more useful then. So these are questions that get emailed in quite a lot. So can I study the program full-time in 1 year? No, it's part-time over 2 years only. Why do we insist on part-time study? Because we want everybody who studies this program to be working in healthcare, clinical pain management. And the student attrition rate, so the dropout rate, if you have people doing full-time study alongside full-time work, is huge, it's astronomical, it's just not worth doing the program. So we want everybody who starts to finish, and we want to support everybody who starts to get to the finish. And one of the ways that we do that is by insisting on it being part-time over 2 years. You can take longer than 2 years to study. You can study it as modular or flexible on a module-by-module basis up to 5 years. But that's in exceptional circumstances, and if you're thinking that that's something you might need to do, I would ask you to contact me directly and we can talk about that. There's a lot of issues, there are some benefits with doing modular and flexible study over 5 years, but there's a lot of issues that come up and people just lose interest after about year 3, and we want everybody who starts to finish. What are the fees? So there's the current fees, they're available online. They seem pretty high. The fees are set centrally by UK government. All postgraduate taught courses are given a band range that they can fit, and all of the information I told you at the beginning about how amazing UCL is means that UCL put themselves at the top of the band range. So it's just the top of what the UK government says that we can charge. And what about Brexit? I'm not sure if it applies to anybody who's here, but currently all EU students who enrol pre-Brexit will have UK EU fee status for the duration of their programme. There has been no decision or information from the Department for Exiting the EU about what will happen after the transition period, or if we're having a transition. But if you are an EU student and you're depending on the UK EU fee rate, the time to enrol is now, because you need to enrol now before next March to be guaranteed your EU fee status. So this is available online on Paying Your Fees website, and gives you all the breakdown of what all the different cert, diploma and all that cost. Any questions?